Hi, I'm Dr. Sachar. Today we're going to talk about asthma in pregnancy. This presentation is being brought to you by V. Sachar, MD, the world's first and only makeup exclusively made for pregnancy. We wanted to give women a safe alternative for their cosmetics needs during pregnancy. Now, asthma in pregnancy. Asthma is characterized by a hyperreactive airway, which becomes hyperreactive in response to a trigger. These triggers can be something as simple as a weather change, cold mornings, hot afternoons, talc, cigarette smoke, acid reflux, and even other people's makeup. The good news is asthma is reversible with the use of medications and avoidance of these triggers. In pregnancy, there's a lot of confusion when people first find out they're pregnant. Do I continue my medications or not? Do I stop them cold turkey and risk having an asthma attack? Well, the answer is pretty simple. Keep taking your medications. For the most part, the medications that you're being treated are reversible broncho airway dilators, which are called Ventolin or albuterol, or sometimes inhaled corticosteroid. Most of these medications are very, very safe. The best thing is to first continue with your medications, see your obstetrician or a high-risk pregnancy doctor, and then get their opinion whether or not to continue your exact medications. Risking continuing without medications and having an asthma attack can be very serious at times. Asthma is divided into different categories: mild, moderate, and severe. Most people who have asthma, about 1/3 get better or stay the same. 1/3 are exactly the same, no difference, and 1/3 get worse. It's those 1/3 that get worse that we're always very concerned about during pregnancy. So for the most part, you have a 2 out of 3 chance of being perfectly fine during your pregnancy. What to do and how to treat yourself? Well, if you do have an asthma, the first line of treatment is inhaled albuterol or a bronchodilator. This you take through an inhaler. This is Ventolin. You press down on the container, and as you inhale, you take a breath, like this. You exhale completely, start inhaling, and while you're inhaling, you press down the canister, and the breath goes directly into your lungs. This will control mild asthma very well. You take it when you have an attack, some wheezing, etc. People who have more moderate or severe disease need to have a little more control and containment of their symptoms. You should know what your peak flow is. A peak flow meter is a meter that looks something like this. This is very affordable. It comes from any drugstore. Sometimes your doctor may prescribe it to you. It's used to keep a log for yourself, so you know when you're having a more severe attack. What you need to do is actually keep your base or your baseline. You take a deep breath and blow it hard in one breath. My base here is about 600 plus. And normally for a pregnant woman, it should be around 500, 550. Up to 700 is good. So if you're having an attack and you can't breathe, you're taking your medications, you're not getting better, you should use your inspirator to do a quick expiration and see where that number is. If you're only getting about 250 and you should be 500, that's only about 50%. That's a severe asthma attack. That's a time to either to go for help, either the ER or use your next line of treatment or a nebulizer, etc. For most people with moderate to severe asthma, the addition of additional medications is necessary. It's called stepwise therapy. And with that, we have inhaled corticosteroids. These are very safe in pregnancy. They do not pose any risk to you or the baby. They should be continued. There are other medications that can be used during pregnancy, and you should continue to use those and see your doctor to see how much you need. In general, for severe attacks, if you might go to the ER or see your doctor, they might give you oral steroids. Oral steroids are generally pretty safe. We try to avoid them in the first trimester, but other than that, that's fine. And because it's a burst for only 5 or 6 days, it's not too long to continue. After that, the mainstay of your treatment should be the inhaled steroid, which is something like budesonide, as recommended in pregnancy, and that will allow you to use the Ventolin even less. So what I always tell patients is keep your budesonide or your inhaled steroid in your purse, at home, and your inhaled albuterol, etc. in your purse. When you wake up in the morning, you'll take 2 breaths of your inhaled steroid. At night, the same thing, and this would be for breakthrough attacks only. Another symptom of an attack of pregnancy is nocturnal asthma, and this can arise clinically in case you're having nightmares at night. You wake up at night, you can't sleep, you're having nightmares. It could be an asthma attack. And also this could be triggered by reflux, gastroesophageal reflux, or extra acid. Because you're pregnant, your lower sphincter in your esophagus loosens up, the acid can come up into your esophagus during your sleep, and then it refluxes back into your throat, into your airway, causing that hyperreactive airway. For that, you may take all these medications. They may give you some relief, but the best treatment is to avoid the trigger. For those symptoms, maybe an antacid, such as Zantac, or something like an H3 blocker, which would be a proton pump inhibitor, such as Nexium. Again, talk to your provider to get those exact medications. Asthma is very treatable during pregnancy. The best message I can tell you is continue taking your medications. But what about the risk to the baby? As long as you can breathe safely and are not having any shortness of breath symptoms throughout your entire pregnancy, the risk to the baby is minimal to negligent. If you're well controlled with your medications, the albuterol, the budesonide, you don't need any accessory testing for the baby. But if you're having difficulty with your control and need lots of medications or have frequent attacks, getting regular ultrasounds to check the baby's growth and checking in the third trimester NSTs to make sure the baby's heartbeat is okay and fluid is a good idea. Again, ask your provider. This is the end of our first talk. Thank you very much.